Well, doctors learn more every day about the deadly coronavirus, but many questions remain. That's why we're reporting Just the Facts. Thanks for joining us. I'm McLeod Hegeman.
And I'm Christy Batista. In tonight's 30-minute special, we're sharing your concerns with medical experts to bring you the most up-to-date answers, since new information is learned daily.
The following is a special presentation of WCIA 3 News.
We don't know a lot about this, and we've been learning a lot since the beginning.
It's only been around for, months.
Everyone at this point should just assume they have COVID-19, assume that others have COVID-19, and behave accordingly.
This is 30 Minutes COVID-19, Just the Facts, with Christy Batista and McLeod Hegeman.
We begin tonight with an inspiring story about a man who beat all odds.
Paul Frazee tested positive in late March, and he kept testing positive for months. At nearly 80 years old, he beat the virus. Courtney Bunting has been checking in with Paul and his family for months to see how he's recovering, and she shares this inspiring message for anyone going through the same situation.
If you met Paul Frazee today, you'd find a happily married man with a love for life and family. You'd probably be surprised to hear that 5 months ago, he was fighting for his life. The 76-year-old Arcola man's struggle with COVID-19 began in late March.
I'd had a cough I've been fighting with for several days. Never thought too much about it because I'm susceptible to bronchitis.
But Frazee says he was so out of it, he doesn't remember much.
I hallucinated a lot. I guess I caught snatches and bits of conversation on occasion. The doctors had almost given up on me. They'd done all they could do. And from what I understand, they told my family you might have to consider pulling a plug at some point.
There was 2 times we thought we'd lost him.
His wife, Marcia, says she spent a lot of time worrying and struggled with him being gone.
It was just lonesome and not knowing what was going on. I did find myself walking down the hall to tell him things and then stopping before I got to the door. Oh, he's not here.
Thanks to the care of doctors at Carle, Frazee was able to pull through. He then moved to Chicago to start his recovery, and then to Generations in Lincoln. The two even celebrated their 55th anniversary while he was there. Frazee says getting back to his old self was no easy feat.
Had to learn to walk all over again. Didn't have no strength, but they worked with me and got me back on my feet. To realize where I came from to where I was that day, it was just fantastic.
Now he's eating home-cooked meals and mowing the lawn again, but his journey isn't over.
I'm getting stronger. Still lack a lot of energy. I never felt old until this hit me. This sickness has taken its toll, but we're going to defeat it.
And that same persistence, mixed with a little faith, may be the secret to his success.
Where there's breath, there's life. And God can bring you through.
In Arcola, Courtney Bunting for 30 Minutes.
And such an inspiring story right there. Frazee says he's grateful for his family and for the support he got from his community. He said one of the hardest parts of his experience was not being able to see his family during his illness.
Russia is the first country to approve a COVID-19 vaccine, paving the way for mass vaccinations. But health officials around the world are skeptical and have expressed concern. They say the country is ignoring safety procedures. The first doses were given to volunteers at the beginning of the summer, but some say Russia skipped widespread human trials, which is a move health officials hope won't be replicated. The World Health Organization says there are more than 100 possible vaccines being developed around the world to curbing the pandemic. Healthcare providers say they're bracing for a busy flu season, and with the coronavirus in the mix, there's an even bigger concern. Karina Rubio explains why.
Healthcare workers with Carle say we already know the flu vaccine is safe and effective. Getting that shot could help avoid any potential challenges in balancing flu cases with the coronavirus as experts work to learn more about both. Carl experts say their goal this year is accessible flu shots for everyone. They will set up 3 sites to distribute the flu vaccine this fall, and it'll look a lot like COVID-19 testing at the mall.
These two viruses causing significant impact at the same time are a legitimate concern. The more people we immunize against influenza, the better we are prepared as a society to focus our attention just on the one virus that's so overarching these days.
Dr. Michael Smith with Carl says unless you have a known allergic reaction to it, which is rare, everyone 6 months and older should get protected against the flu. Their concern is hospital space for treating patients for the flu and COVID-19. Dr. Smith tells me CDC experts say a COVID-19 vaccine won't be available this fall. Carl will help people get vaccinated here at home too. For 30 Minutes, I'm Karina Rubio.
And if you need a flu shot, you are in luck. At least 3 locations will be set up around the Champaign-Urbana area. Carl-Urbana on Windsor and Carl at the Fields will go from September 26th to October 18th during daytime hours on Saturdays and Sundays. The Marketplace Mall site will run September 29th to October 22nd from 11:30 to 6:30 p.m. on Tuesdays, Wednesdays, and Thursdays.
Medical experts at area health departments have been working overtime as the pandemic gains momentum across the world and right here in central Illinois too. We spoke with area health administrators to answer your urgent medical questions in tonight's 30-minute report. Here's what they had to say.
Many of you are wondering, are asymptomatic people less likely to spread the virus? Gail O'Neill from Sangamon County.
Well, not really. The asymptomatic just means they don't feel sick. And that's kind of the ones that we're really worried about spreading in the community because they don't know that they have been, potentially spreading the virus because the virus is spread a few days generally before illness sets in. So it's difficult for people that are asymptomatic, had no idea. That means they have no symptoms, so they have no idea that they should test or that they should have been, protecting other people from them.
Mindy McClard wants to know what it means to be a novel virus and should we really be comparing it to the ordinary flu? Brandy Binkley from Macon County has that answer.
There's not herd immunity to it. There's not a vaccine. We don't know all of the long-term implications that come along with having COVID-19. They're finding more and more about possible long-term implications that can be experienced by adults and by children. I know early on in this COVID response, there were so many people that, and they still do, have this misconception that this is just something that affects older people in the population, and that's absolutely not true.
Chase Griffin asks, are people listed as recovered or testing negative still experiencing symptoms months later? Julie Pride from the Champaign-Urbana Public Health District explains.
What recovered means essentially is that the case is no longer in isolation or hospital. It doesn't mean that you're not still having symptoms. It means you're no longer infectious, but it doesn't mean that you're not still having symptoms. We've known people who have gone, a month or longer still having symptoms and still having extreme fatigue or various other problems on oxygen, things like that. So recovered really is just something that means that they're no longer an active case. And for public health, an active case is someone who is currently infectious and in isolation.
And Sarah Marshke wants to know why recovery numbers are not being tracked. They are, and public health officials in your area are posting those numbers online.
All 3 health administrators say there is still so much to learn about this virus. They're learning more every single day. So while we all have been very patient, they stress the importance of staying calm and staying up to date because things are still changing. Well, coming up on Just the Facts, we'll head back to the hospital where the first COVID-19 case was reported in central Illinois.
But first, we are dedicated to debunking those common COVID-19 myths. Take a look.
maybe we know some of those tests are wrong based on the statistics, which, from a public health standpoint, drives a lot of the things we do to try to prevent transmission.
We are reporting facts, not fear, as new details emerge daily about the coronavirus. And breathe easy, that's the message from a doctor in Rockford to those worried about wearing those masks.
Dr. Jacob is a pulmonologist at OSF Healthcare, and he ran a series of experiments looking at whether some common excuses not to wear protective gear. A test patient was hooked up to a machine that measures blood oxygen levels. The patient wore a cloth mask, disposable surgical mask, and an N95 mask. In all three cases, her blood oxygen level stayed in the healthy range, even after leaving the coverings on for several minutes. A new Gallup poll from CBS News indicates more people are using masks.
That's right. 86% of Americans surveyed say they routinely wear those masks when they're out inside at places like the store or even work. Meantime, 46% of Americans say they wear them while they're outside.
There's been a lot of debate on whether masks actually work. Professors and students at SIU School of Medicine coughed into agar plates with and without a mask, let it sit for 24 hours, and found both homemade masks and surgical ones prevent droplets from escaping. We did our own experiment with a professor from Carle, Illinois College of Medicine, and it's one you can do at home too.
Okay. Oh, wow.
Professor Helen Nguyen stopped by WCIA for a mask demonstration.
So if you have a mask, you see it stops right there.
She sprayed colored water to show how masks work.
This side here is a lot of liquid. This side here, there's a little bit. When we sneeze, that means that we really expel the air, from us, right? So that tip of the squeeze button is like at the same size of the nose, actually. Okay, and then because we got so uncomfortable, we sneeze. So we expel that much air at that speed.
She shows that by spraying the dry erase board 6 feet away without anything in front of her.
And if you see the board, you can see there are small droplet and big droplet. So the small droplet will remain in the air longer in suspension, can travel to a greater distance.
Same goes for a sneeze or a cough, and it depends on the air circulation too.
So depends on the airflow inside the room. This droplet can get to another person even further away from that 6 feet.
She also showed us what that looks like with a cloth mask.
Okay, so it stops right there. Okay, and you go this side here, it still have a little bit here. Okay, yeah, but very similar to the other mask. The story remains exactly the same.
And even though it's something we're not used to, it does stop the spread.
The virus didn't go anywhere yet. So it arrived here around January. Now we are August, almost September, it's still there because it's silently, invisibly go everywhere. So it's uncomfortable to wear masks. There's no question about it. So when I teach, I have to wear masks too. You guys all wear masks now. And kids will feel very uncomfortable when they have to do it, and they play and they sweat and everything. But it's necessary.
Do you believe that if we wear masks, we can save lives and we can stop this virus from spreading even further?
100%. Totally. That we will, and this is the action from each one of us. We will definitely reduce the spread of virus. There's no question about it.
Governor J.B. Pritzker issued new rules allowing local authorities to fine businesses, schools, and even child care facilities that repeatedly fail to enforce the statewide mask mandate and social distancing guidelines.
And the governor says the new emergency rule would set up a 3-step enforcement process. That means workers have to wear face masks and people must maintain social distancing guidelines. Secondly, these groups will be given written warnings if they're not complying.
Now is the time. We must make sure, this is a make or break moment for the state of Illinois, for making sure that people are doing everything they can to mitigate, to reduce the spread. And so this is a moment for us to enforce the masking requirements across the state.
If a business owner repeatedly ignores those rules, they could be fined.
30 Minutes COVID-19, Just the Facts, continues here on WCIA 3.
I think when people hear they've been exposed to someone, they want to run out and test. And we are trying to encourage people to get a good test. You need to let at least 4 days pass from the time you might have been exposed to that person or the last exposure.
A reminder that it takes time to get the best possible results when testing for COVID-19. Now, despite those lingering COVID-19 concerns, everyone is adapting to a new normal. We visited Sarah Bush Lincoln Health Center in Mattoon, where the first case in Central Illinois was confirmed. Doctors explained what they've learned in the last few months and whether they were prepared.
For those of you that played any football as a kid, you know, that first hit, that first contact you get in a football game makes you feel like the tension drains out of you, all the anxiety drains out of you. Now we're just here to do a job, and it felt a little bit like that to me.
Sarah Bush Lincoln Administrator Dr. James Hildebrand expressing a sense of relief, knowing his medical staff was as prepared as they could ever be when the coronavirus first hit Central Illinois. They got the call mid-March someone was coming in to be tested. A plan was already in place, and extra precautions were taken to ensure the virus wouldn't spread to other patients or staff members. Fast forward 5 months with the United States confirming more than 5 million cases so far. Compare that to more than 12,000 killed and 274,000 hospitalized from H1N1 from 2009 to 2010, at least 100,000 killed from the flu pandemic in 1968, and a third of the world's population infected by the flu pandemic, with 675,000 killed in 1918. Dr. Hildebrand saying current COVID-19 restrictions are certainly justified to saving lives and curbing the spread.
Last year we had about 34,000 people that were estimated to die from influenza. The overall impact on us is much higher.
Sarah Bush Lincoln is one of the first healthcare facilities in Central Illinois to report a positive COVID-19 test. And since then, people have been stopping by this testing site daily to get checked out. And healthcare providers say one of the biggest takeaways that they've been able to learn in the last few months is that these masks work and help preventing the spread.
When I wear a mask, it's really a statement of my respect for you and for the other people around me, more so than it is a way to protect myself. It does both. It does protect me and it does protect you.
Dr. Hildebrand saying medical experts at Sarah Bush are learning more information daily about the virus, including long-term effects like fever, vision problems, burning skin, exhaustion, hair loss, brain fog, and even shortness of breath. New studies even indicating it's attacking men differently than women.
As men are definitely more affected. Not sure if they get infected more often. I think the case attack rates were pretty similar to each gender, but they get sicker and they die more often than females do.
Dr. Hildebrand answering several questions just months after the first case was confirmed in Central Illinois, but many remain unanswered as medical experts investigate new information daily, like whether we're immune from the virus after recovering.
It's still an area of investigation and some controversy, but the best evidence is that you probably are protected from coronavirus after you have it and you recover, at least for a few months.
And medical experts in Coles County say they are seeing an uptick in cases of COVID-19. Well, saliva testing has helped the U of I do more than 60,000 tests in a month for students and those staff members. Now, classes will be a mixture of online and in-person, and those face-to-face meetings will be saved for smaller lab-type classes. All residence hall rooms have a 2-person limit, and no outside visitors will be allowed. Dining halls will also be limited with packaged carry-out meals available. There's also designated quarantine areas for students who test positive and those who may have symptoms. Educators say they'll be keeping a close eye on the next 2 weeks to see how they'll move forward this semester.
30 Minutes COVID-19, Just the Facts, continues here on WCIA 3.
It seems at this point pretty rare that people are getting sick with COVID twice. Probably not impossible.
And medical experts learning more every day as the pandemic spreads across the world and right here at home. And one of the greatest debates this summer has been, how serious do I take social distancing?
Some people are limiting their interaction as much as possible, while others don't seem to be fazed by medical advice. Despite cases ramping up across the region, yearly events like the 10th annual White Trash Bash are going on as planned. This was the scene earlier this month as hundreds of people ignored COVID-19 protocol and hit the water in East Peoria on the Illinois River.
This isn't a sanctioned event. We started having law enforcement present about 4 or 5 years ago because we will get a lot of fights on the beach. It's the perfect element for a problem. You've got beautiful weather, you've got lots of alcohol.
Even though most event goers didn't seem concerned about catching COVID-19, we are seeing more cases every single day. To see whether areas have been more affected by events like these, you can visit the Illinois Department of Public Health's website. They post daily updates for issues like positivity rate and whether hospitals in those regions are seeing more patients being admitted. Well, thanks for joining us for 30 minutes of Just the Facts.
And we have posted all these resources from the past half hour to our website at WCIA.com if you'd like to follow along with this coverage.
Thanks again. Have a good night.